Thank you so much for joining us today to learn more about our recently launched Financial Health and Wealth Dashboard. My name is Signe Mary McKernan, and I am Vice President of the Labor, Human Services, and Population Research Center at the Urban Institute and a financial well-being and wealth expert. Before we dive in, a few housekeeping notes. This event is being recorded, and the recording will be posted online afterward. Speaker biographies and slides are available online. To hide captions or adjust your settings with you can use the live transcript button. All participants are muted, but you can type your questions or comments into the Q&A box at any time. And please take 1 to 2 minutes to complete the survey at the end of the event. And then you can engage with us online using #LiveAtUrban. So the financial health of a community depends on its residents' ability to manage their daily finances, to weather economic shocks, and then to pursue opportunities for upward mobility. And with access to financial data at the local level, community leaders can make informed decisions to strengthen the residents' financial health and to address stark racial disparities. So several years ago, Urban set out to understand the connection between financial health of residents and the financial health of cities, and to make the case about why local leaders should care about the stark racial and geographic disparities we see in financial health. Our research measured and demonstrated the connection, and that local leaders have powerful levers that they can use to improve the financial health of their residents, and in turn, then the financial health of their cities. So to equip these leaders with data and evidence to assess those connections, we launched the original version of this dashboard back in 2018. It was the first time that we were bringing together our credit and debt data at the city level, and then pairing it with strategies for local leaders. And that original dashboard included data at the city level for 60 of the country's largest cities. And it proved a valuable resource for those cities. But since then, we've been working hard to paint a fuller picture of financial health that can better capture the stark racial and geographic inequities in our communities, and also to equip local leaders with strategies that can meaningfully address the structural barriers that are driving these disparities. So this new dashboard is a culmination of that work. Oria and Ming Li, my colleagues, will provide a more detailed overview of the dashboard's components, but I wanted to call out 3 ways that the dashboard is a powerful contribution to the field. First is that this dashboard provides robust data for the entire country. So no longer just 60 cities, but the entire country at a low level of geography, evolving from data at the metro level to smaller local areas known as PUMAs, which are local areas containing no fewer than 100,000 people. It also provides racially disaggregated data for 107 of the largest cities in the country. And then the second is that we leveraged our team's data science capacities to impute wealth estimates of median net worth and emergency savings at the local level for the first time. And although net worth and emergency savings can be measured at the state level for most states, data at these local levels are rarely available, and they can be very powerful in motivating action and in informing policy. And then finally, we refreshed and expanded the suite of strategies that local stakeholders can consider to improve the financial health of their residents in the cities. It was important to us that the dashboard provide evidence-backed solutions, not just problems. And so these strategies span a range of sectors, including workforce development, higher education, housing, and small business. And they're intended to spark ideas and to provide direction that local leaders about ways that they can invest in their residents' financial health, and then also narrow the racial wealth gap. So these are a starting point with real world examples linked into them and resources to help city leaders prioritize options, and then also to learn from one another. So taken together, the new dashboard complements the many ongoing initiatives and tools from partners in the field, including from a few you will hear about later today. who are focused on advancing racial equity, improving financial health, and closing racial wealth gaps. Before I turn it over to my colleagues, I want to take a moment to thank JP Morgan Chase for their support of this work. The Urban Institute has been collaborating with JP Morgan Chase to inform and catalyze a data-driven and inclusive economic recovery. And this dashboard is the culmination of much of that body of work where we've been collaborating on for several years, and we are grateful for their steadfast support of this research. So with that, I will now turn it over to my colleague, Oria Cohen, and Oria will walk you through the dashboard or how the dashboard can be used to understand community conditions and to inform action at the state level. Oria?
Thank you, Sigmary. So nationally, we know that racial disparities in wealth, debt, credit health are stark, and that the financial gaps between households of color and their white counterparts continue to grow or remain stark. We also know that a history of racist and discriminatory policies and practices bake these financial health disparities into the geographic makeup of our communities. Using our three-part definition of financial health, which we define as a household's ability to manage daily finances, be resilient to economic shocks, and pursue opportunities for upward mobility, we explore the extent to which these national trends show up at the local level. And the data from the dashboard illustrate these financial trends are very much reproduced in communities across the country. So to help illustrate how the tool works and explore some of these local trends, I'm going to walk through just a couple of the metrics in Washington, D.C., and connect them to solutions as an example of how a local stakeholder might use the tool. So starting with delinquent debt. Financial burdens such as delinquent debt are signs of financial distress that can affect a household's ability to meet basic needs. Delinquent debt also affects credit health, which is vital to families' abilities to weather financial shocks, access capital, and invest in wealth building opportunities. So in the DC area, we find a large gap in the share of residents who hold debt by race and ethnicity and geography. Among those living in the PUMA east of the Anacostia River, for those in DC, that's made up mostly of wards 7 and 8, 50% of residents have delinquent debt, making them twice as likely as other DC residents to face this financial burden. And similar to national trends, delinquent debt in DC disproportionately affects communities of color. For example, residents living in majority Black communities are nearly 4 times more likely than residents living in majority white communities to have delinquent debt. As we've seen daily expenses increase with inflation, the ability to manage daily finances is becoming more difficult, especially for households with debt. So local leaders can help residents by eliminating harmful debts, such as municipal fines and fees. Solutions can also be targeted to areas with high debt through improved access to banking, debt forgiveness programs, and cash transfers. I'm now going to talk through economic resilience and the role of emergency savings. So emergency savings offer families a cushion against economic disruptions such as job loss, health emergencies, natural disasters, and price increases. And without savings, residents are at a greater risk for eviction, more likely to fall into spirals of debt, and less able to invest in wealth building opportunities. In DC, we estimate only 42% of households east of the Anacostia River have at least $2,000 in emergency savings, compared with the 70 to 89% of households with emergency savings in the rest of the city. And again, disaggregating data by race shows that white households are 2 times more likely than Black households to have at least $2,000 in savings. So local leaders can increase economic resilience and encourage savings through child savings accounts, expansion of the earned income tax credit, and match savings programs like they have in DC with the DC Opportunity Accounts. They can also address these inequities by protecting households from economic crises through things like eviction diversion programs and expanding access to safety net programs. And the third metric I'm going to talk through is net worth. Net worth, which is calculated as total assets minus debt, can indicate a household's ability to build wealth. When we examine wealth gaps at the local level, households living in majority white communities in DC have 23 times more wealth than households living in majority Black communities. As a result, Black residents have less opportunity to invest resources in themselves and their communities, and are less able to transfer wealth to future generations. Net worth also varies drastically by geography in DC, with an estimated median net worth of more than $620,000. residents in the northwest region of the city, which is made up of wards 3 and parts of wards 2 and 4, have 65 times the net worth of residents east of the river. And so as you can see here in Southeast DC, the median net worth is less than $10,000, which greatly limits the ability of households to invest in education, entrepreneurship, homeownership, and other wealth building opportunities. To address structural barriers to upward mobility, local leaders might consider increasing workforce investments that provide pathways for high quality jobs, supporting small business growth, particularly for Black, Latinx, and women-owned firms, and encouraging community wealth building strategies such as community land trusts. Currently, DC leaders are leveraging place-based and race-conscious solutions such as a baby bonds program and the Black homeownership strike force to address the decades of racially discriminatory policies that have contributed to the city's racial wealth gap. So as the DC area painfully demonstrates, residents' financial health varies largely by geography and by race. But DC is not unique. Structural racism embedded these same trends across the United States, with communities of color consistently holding less wealth and showing more signs of financial distress than white communities. This decreases the ability of individuals and communities to manage daily finances, to weather economic shocks, and pursue opportunities for upward mobility. We hope local leaders can use the dashboard to see who's at the greatest risk of continued financial hardship, to identify strategic solutions to improve financial health, and use this evidence to motivate action that can address the multiple facets of financial well-being and the structural barriers that created and continue to reinforce racial wealth inequities. I'm now going to turn it over to my colleague Ming-Li Zhang to provide more detail about the components and the methodology we use to develop the dashboard.
Thank you, Aurea. The dashboard includes 10 total metrics. To generate the data for these 10 metrics, we used a combination of data sources, including American Community Survey, ACS, Survey of Income and Program Participation, SIP, and credit bureau data. As Aurea mentioned, we group these metrics into 3 categories based on Urban's definition of financial health. These 3 categories are the ability to manage daily finances, be resilient to economic shocks, and pursue opportunities for upward mobility. Now, I would like to talk a little bit more about how we develop the estimates for an emergency savings and net worth. We usually see wealth data at the state and national level. Wealth data at the local level are usually not widely available. To fill the data gap, we developed a machine learning approach to estimate 2 wealth metrics. These are households with emergency savings above $2,000 under the economic resilience category and median net worth under the upward mobility category. We use machine learning models to provide data for these 2 wealth metrics for every local area, covering the entire country. That includes rural areas and smaller towns. If you're interested in learning more about our methodology, you can explore our technical appendix, which my colleague just dropped a link to the chat box. Users can search their community by city or zip code. Once they've drilled down to the local level, the dashboard offers 2 functionalities to help cities make decisions about their residents' financial health. Users can either use the PUMA view, which is the local area we look into, to look at their own local areas. PUMA is defined by the Census Bureau as local areas containing more than 100,000 people. We can compare local level data to the rest of the city, state, and country. This could allow users to prioritize what local areas need more specific supports. Users can also explore the bonus city data, where we provide additional city level metrics disaggregated by race and ethnicity. At a PUMA level, we provide racial and ethnic demographic data for each local area covering the entire country. This gives us more context on the community makeup. We also present data on each metric at a PUMA level, and we provide comparisons to state and national data. At a city level, we show data for 5 key metrics for 107 select cities where data are available. We disaggregate data by racial and ethnic communities for these 5 metrics at the city level. If you're interested in analyzing the data on your own or combining with other data sets, you can download the data on Urban's data catalog. If you're interested in exploring the strategies for local leaders to improve financial health and wealth, you can explore the full suite of strategies at the following link. All of these downloads and links can be found on the dashboard website, and we also drop all the links to the chat box. Now, I'm going to turn it over to my colleague, Thea Guerin, who will moderate our panel discussion.
Thank you, Mingli. Congratulations to you and the entire team on the release of such an impressive tool. My name is Thea Guerin. I'm a Senior Policy Program Manager on Urban's Wealth and Wellbeing team. And I'm thrilled to be your moderator for today's discussion with local leaders about how they are using insights like the ones that you all just shared to improve the financial health and well-being of their communities. So at this point, I'd like to invite our panelists to go ahead and turn on their cameras so they can join us for today's discussion. While they're turning on their cameras, I'd like to take a moment to extend a heartfelt thank you to each of you on behalf of the entire Urban team for taking time out of your busy schedules to join us today. I'd also like to take a moment to remind our webinar attendees to submit questions for our panelists throughout the discussion via the chat feature on Zoom, and then we'll address your questions during the Q&A portion of the webinar at the end of the conversation. So with that, let us go ahead and get started. And as you heard from Signa Mary, from Aurea, and from Mingli at the beginning of the webinar, Urban created this dashboard to help local leaders like all of you understand the financial health of your residents and identify strategies that can improve the financial well-being of your communities. So I'd like to begin by asking each of you to share how the local level data in the financial health and wealth dashboard can support your particular work to improve financial well-being in your communities. And I'll ask each of you to please introduce yourselves before sharing your response to this first question. So Tamara, let's with you, then we'll go to Erica, and then we'll go to Amaya for this question.
Great, thank you so much for having me. Thank you, Urban Institute. My name is Tamara Lindsay. I am the Chief of Strategy at the Cities for Financial Empowerment Fund. We are an organization that focuses on working with local governments to embed financial empowerment initiatives like consumer protection, asset building, financial counseling, and access to banking. So I was also privileged to be part of the dashboard advisory group, so got to see the behind the scenes work as well. To answer your question, you know, when I started this workout about a decade ago, the poverty rate was the thing that everyone pointed to. The data was about what's the poverty rate in the city. And it actually became really depressing because what do you do with poverty rate? It's 10%, it's 12%. There's nothing really that speaks to solutions there. And so dashboards like this give you a sense of the array of different types of metrics that play into the financial health of a community and a city. I'll give you an example of this. We worked in one city where the mayor was really interested in home ownership. That was going to be one of his major features of his platform. And what we found when they started to look into it is that communities' credit scores in neighborhoods that they want to serve were pretty low. That brought about the idea of how do we increase credit scores? Because if your credit score is low, the access to an affordable mortgage isn't there. And so the idea was, let's look at one-on-one financial counseling to support increasing your credit score that then gets you to home ownership and community and neighborhood revitalization. And so for me, the poverty rate didn't get you there. These very nuanced types of metrics got you to that kind of solution. And dashboards like this help cities understand the scope of issues a lot more so that the solutions can be pretty diverse.
It's a great example of targeted solution to a very localized challenge. Wonderful. Erica, over to you.
Good afternoon, and thank you as well for the invitation. I'm leaning in because I'm excited. to have it. I am Erica Wright. I'm the VP of Global Philanthropy with the JP Morgan Chase Learning and Insights team. Prior to joining Learning and Insights, I actually served as the program officer leading strategic investments in Louisiana, Tennessee, and Missouri for the foundation. And so I'm bringing a bit of my regional and national hat to this conversation. So I want to lift up two points in response to your question, Thea, one of which builds on Tamara's response around having local data and really being able to drill into poverty rates in a meaningful way. And I want to raise the point both just by giving a response, but then also giving a very local example. So to the earlier point, having local disaggregated data gives us an opportunity to be more intentional and targeted around our responses and interventions. But it also allows us to see where an individualized kind of household level response might be meaningful, and then look at kind of growth inequities and disparities and see where some of these things are driven by systemic level challenges, right? And so, yes, you have to be targeted and intentional and address folks at the household level, but then you also have to zoom out and think about what are the underlying challenges and conditions that are creating these problems for families and individuals. An example of this would be, Southern Louisiana, post Hurricane Ida in 2021, insurance rates increased for households from between 40% to 100%. And when you think about having large data sets that also drill into the local level, it gives you a better understanding of the financial health of your households and communities and the disparities that exist. So when you're thinking about deploying resources, when you're thinking about the communities that are going to be most vulnerable, when you see an increase of that magnitude, that level of data will give us some insight into how to direct resources in a thoughtful and meaningful way. While that kind of short-term immediate response is critical as we think to the future, right? We are going to continue to experience climate and environmental shocks. We also have to kind of do that zoom out and think about what changes and interventions need to happen around insurance, around resilience, so that families and households that are going to experience those kinds of shocks over time are prepared to weather them. The second point I just also want to make is that I am part of the foundation, so a philanthropic entity. That data drives how we make our philanthropic investments, but it also drives how our business is thinking about how it serves communities. And so I think having very specific local data also pushes for a very direct conversation about how institutions show up in communities, which I think is valuable.
I'm so glad you made that last point, because we have service providers, we have policy folks represented on this call, philanthropy for sure, but business decision makers are such an important element of the equation as well. So I'm glad you flagged that. Maya, over to you. I'm excited to hear your examples, because I think they'll likely focus on the great city of Chicago.
Yes, thank you again for having me, and it's such a great panel. My name is Amaya Pawar. I'm a senior fellow with the Economic Security Project, where I work on policies and advocacy to reimagine public finance and think about public banking, and then a second bucket on guaranteed income policy. Before that, I was an alderperson in the city of Chicago. I served 2 terms between 2011 and 2019. And I worked on a lot of issues connected to social and economic justice, including raising the city's minimum wage, guaranteeing paid sick leave, combating wage theft, and a few other things. This dashboard, it would have been really amazing to have this as a legislator. Let me just say, it's a really elegant presentation of financial health down to by zip code. And it's really amazing, primarily because, so when I think about the community that I used to represent, so that zip code is 60613 on the north side of the city of Chicago. It was a predominantly white community. The median net worth, according to the dashboard, is about $132,000. And then if you go 10 miles south and slightly west to Englewood, Chicago Lawn and West Englewood, predominantly Black community, about 23% Hispanic. The median net worth there is $5,400. So, it's the same kind of massive disparity that we saw in the DC example in your slides. And I think what you'd find in the community, this last community in Englewood is, yeah, you have the median net worth of $5,400, but you also have overlapping deserts there, right? Deserts of banking, pharmacy, grocery, affordable housing, the list goes on, broadband. And what I like about the dashboard as it informs policymakers is, yes, we need to raise wages. That number tells you people aren't making enough money. It also tells you that when you layer on the deserts on top of that, people are paying more for services there than they would in other parts of the city, to cash a check, to take out short-term credit, to buy fresh produce. But it also cuts into narratives. And so one of the things that I saw as a former policymaker, dealing with fellow lawmakers and with philanthropy and with civic leaders, when we had the first guaranteed income task force in the country, locally led one, is the city's civic leaders could not get around the fact that people didn't have $300 or $600 in the bank to weather an emergency. It came down to, what will they do if we give them money? Do they really deserve it? Are they working hard enough? This kind of dashboard helps kind of illuminate and surface what's really happening and puts data in front of you on a map, puts it right in your face, which I think is fantastic and is sorely needed as we think about tackling the racial wealth gap.
Absolutely. And so even though these stakeholders probably were aware of the national statistics showing, the 40% figure from the Federal Reserve lacking sufficient money to weather an emergency, having the data in front of them for their communities is so powerful and makes such a difference for galvanizing action and buy-in and collaboration, which we'll talk about in just a minute. But Amaya, I think your answer teed up nicely our next question, which is about geographic and racial and ethnic disparities in financial health and wealth across communities. So you spoke about this within the context of Chicago. We heard Oria present some of these findings within the context of Washington, D.C. And so I'd like to hear from each of you, what effective strategies are local leaders in your communities embracing to address financial health and wealth disparities of your residents? Let's go ahead and start with Erica for this first question.
So I think, and we'll touch on this a bit later as well, but I think an important point to make is that financial health, and this was made in some of the comments that were just shared, doesn't happen in a silo, right? It's intersecting with a number of other areas and sectors. And so one of the examples that I think is incredibly innovative and thoughtful is actually happening across the country, but has gained a lot of momentum locally in New Orleans over the last couple of years. And it is the Right to Counsel initiative, which is focused on eviction. In New Orleans, this initiative came out of a 2019 report that was authored by Jane Place Neighborhood Sustainability Initiative, which tracked eviction court and eviction proceedings and found that over 80% of folks who found themselves in eviction court were Black, and over 50% were Black women, majority heads of households. And so if you think about the financial security or insecurity of a household and how being evicted might impact a full family, those numbers were staggering. And in response, a local collaborative of organizations, Southeast Louisiana Legal Services, in partnership with the Louisiana Fair Housing Action Center, all of which are focused on housing advocacy, came together to push for right to counsel, which the City Council passed an ordinance supporting. And so now you will see everyone who comes through eviction proceedings entitled to legal representation, which dramatically reduces the likelihood of eviction and increases the likelihood of developing a plan that will keep folks housed. The Louisiana Fair Housing Action Center took that a step further to say, okay, once there is a plan in place, what ensures or reinforces the financial security of that household, and how do we facilitate wraparound services that will help individuals and families build that emergency savings, right? Plan for those economic shocks that are unanticipated and keep them in their homes. And so they are applying a financial health lens and a financial security lens to what at its core may be a housing issue. And what I love is that to the earlier conversation, they took what is a systems level response, right? The right to counsel. So we are going to take, individualized targeted responses to scale by saying everybody has a right. And that was through a focus on a racial disparity and putting in place now an ordinance that serves a broader community and population. And then they will layer on this financial health lens and specifically a debt reduction lens to test and iterate to make a case for a systems play further down the line. And what does debt reduction do to financial security of households? So that is very exciting to me. It's happening in a number of cities, including Cleveland, Denver, Kansas City, Louisville, Milwaukee, and Detroit. But I'm obviously especially excited that it's happening in New Orleans.
What a powerful example. And I was going to say, hopefully a blueprint for the rest of the country, and it sounds like it is. So really wonderful. Tamara, over to you.
Yeah, so, we've been doing a lot of thinking about racial wealth equity, and obviously at the core is disparity. And being able to understand what disparity actually is where dashboards like this come in. And so I live in New York City. I'll give you an example. I looked at the dashboard. Net worth of Black residents in New York City is 11,000. So 11,000, that's sobering. You're seeing that number. And then you look and it's 222,000 for white residents. 11,000 on its own is start. And when you make that comparison, it's sobering. And so being able to have disaggregated data is so important to be able to make those comparisons so you are understanding the full scope of what your population is facing. And in thinking about that, I picked network for a reason, which is because we're doing a lot of thinking around intergenerational wealth transfer. And we started to do some work around embedding estate planning conversations in our one-on-one financial counseling model. And the reason we started to do this is not only on the individual level, being able to connect folks to those kinds of supports, but also there's a real tie to city government. And I want to give you an example from one of our cities, which is, there's a household that doesn't have a title to the home they're living in. The parent provided that household for the kid. The parent passed away. The child lives in that household. They don't have a title to that household. That household needs home repairs. They can't afford those home repairs. There are home assistance access, cash assistance programs in that city, but you have to show a title to the home to be able to access that. So what happens if you can't afford those home repairs? You most likely are going to let it go. Then you are going to most likely abandon that home. And many folks in that neighborhood are doing the same thing. And what a city then has is a blighted neighborhood and has to deal with that blighted neighborhood. And so the idea is if we can look at the individual level and help people think about what type of assets do you have, what type of estate planning can you do, and then you bring it up to the city level. And we have an example of a city where their home repair assistance program includes a mandatory will. If you wanted to access that program, you have to demonstrate that you have a will, and they connect people to legal pro bono legal services in the city to be able to do that. And so I think that is a really innovative way to think about individual level, but also get to, as Erica was saying, you have to tackle the systemic issues associated with these disparities as well.
Absolutely. I so appreciate the specificity of these examples, but then also the connection to the wider context and some of these structural and systemic issues that each of you have flagged so far. Maya, your thoughts?
Yeah, thank you. You know, when I think about innovative strategies, one comes to like the DC example of baby bonds. I mean, that is really a transformational solution, right? To make sure that, you know, a child at the age of 18 has some capital available to them that otherwise would not have been available. That is a systemic response. I think about Montgomery County in Maryland. They're talking about becoming a developer of housing. So rather than just deferring to the markets and hoping that market actors do right by communities, they're going to participate in them. Guaranteed income pilots have spread across the country thanks to the good work of the Economic Security Project and former Mayor Michael Tubbs. You've got over 100 cities now, counties participating, and it's not just about getting cash back into people's pockets so that they're more resilient, that they have the ability to make, you know, they have some dignity to make some decisions about their lives. It's also forcing narrative change, right? About whether we should have cash as part of the safety net, and that, you know, should we be tackling issues like the diaper divide and having these really horrible policies embedded within our social safety net that penalizes people for being poor without thinking about the structures that create this sort of inequity and instability. I think about Evanston, Illinois, which is, you know, starting to pilot a reparations program that's focused on home ownership and providing grants. And then, of course, in California, you have a number of cities that are looking at public banking, not as a way to replace private banks, but as a way to fill in the gaps to ensure that, you know, we treat banking like a necessary utility, not something that you have to travel across the city for, or should you pay more in check cashing fees or interest than you do on food. So I think there's a lot of innovative things, and I think this dashboard, I think, will help policymakers across the country, I believe, look at these issues systematically and not just sort of one-offs in different cities and communities, but really think about the suite of solutions that we need moving forward.
Absolutely. And that's, you know, a common theme, I think, between all three of your responses has been the need for strategies to cut across domains, to embrace this idea of this comprehensive suite of strategies to improve financial health, to reduce racial and ethnic wealth disparities. Oria touched upon a couple of the strategies and solutions that we highlight in the dashboard. I'll highlight a couple others: financial interventions that increase savings, improve credit, expand access to capital, integrated housing and workforce development programs that improve affordability and increase wages, and then, of course, wealth building and wealth preservation opportunities through small businesses, home ownership, and intergenerational transfers of wealth. But of course, identifying and implementing a holistic suite of strategies also requires coordination across multiple actors and multiple sectors. And so I'm curious to hear from each of you how you all are collaborating with stakeholders across your local ecosystems to implement these holistic cross-sector strategies to improve financial health in your communities. Maya, let's start with you this time.
Yeah, that's a great question. I mean, I think, you know, one of the things I think about is all the forces across the spectrum in Chicago that are making people feel unstable or driving inequality, right? So a lot of it is the cost of housing for folks who have children. It's the cost of childcare, student loan burdens, although now we've taken real concrete steps to address that in a real meaningful way, which is amazing. Thank the president for that. But part of it is like looking at those pressure points, right? Which is what's driving this, and how can cities and local governments and county governments and state governments start to address that? And so part of it is when I'm working with stakeholders here locally is to start pushing for participating in the markets. That a lot of the tools that state and local governments have to solve for the consequences of neoliberalism are, in fact, in many ways, neoliberal tools, right? So, so what we should do is say, okay, what tools do we need going forward? And some of that means participating in the markets. Going back to Montgomery, Maryland, they're not just going to wait for a low-income housing tax credit developer to come in and build housing. They're going to start becoming a developer themselves to start filling in the gaps. California is starting to think about filling in capital gaps by establishing public banks. Philadelphia is starting to do that as well. So I think part of the cross-sector collaboration is looking at what's driving instability and inequality, and then looking at ways to relieve those pressure points by actually participating in the markets, not just sort of subordinating the public interest and hoping that the markets do right by communities.
Tamara, your thoughts?
Yeah, no, we collaborate, everyone. If you've got a voice, we hope to get your voice into whatever we're trying to do. And the importance of that is really based on something that just came up, which is this idea of silos. And so we actually, again, as another example, we have an initiative called City Start, which looks to help a city or county come up with an actionable blueprint and to embed financial empowerment in the city government's efforts. And what we found is that, you know, a city government can work on its own, but those aren't always the best ideas, and you want that type of collaboration. And so we bring together a range of stakeholders to have these conversations, from financial institutions to other city county agencies to community partners, businesses, residents. And the common thread there is financial stability. And when you have that sort of common thread, you come up with really interesting cross-sector ideas. And so, for example, you know, you have cities that are looking at, I want to help in my blueprint, I want to help women and children. So when you've got that target audience, then you've got to work with financial institutions on banking access. You got to work with your city government on a number of different things. And so you're just bringing together different types of folks because the lens you're looking at the issue is financial health. The other thing it does is it really shows people that they can work together, and that even if you are, you know, if you think of any social service, the underlying issue is financial instability, if people are accessing that. And so to be able to think about that broadly makes you think about, how do I bring different players into these conversations versus let me just think of it as just housing, or let me just think of it as just workforce development, because all those things are a sort of 360 approach is actually what's going to make a difference.
So it's almost, what I'm hearing is using financial health as this galvanizing lens or framework through which to bring collaborators together. Wonderful.
Exactly.
And Erica, I know from your position, you know, I imagine you do a lot of collaboration and coordination. So eager to hear your thoughts.
We do, and I want to start with a slightly different take, but I'm hoping philanthropy is on the call. So I want to speak to philanthropy first. Because I think as a financial institution, it's a very easy frame to step into a financial health or financial security space and to see ourselves as asset or wealth building funders. But I think philanthropy oftentimes wears its identity and refuses to see how there's intersection. I am a workforce funder, or I am a children, youth, and families funder. I am a small business funder. And so when we have a asset and wealth building conversation, ensuring that we have broad enough definitions and understanding of the intersections of these issues is important so that funders can see themselves inside of that frame, and where, to Tamara's point, there is a through line and oftentimes a foundation of financial stability or insecurity that may be undermining the solutions that you're implementing in any other given space. And so, you know, all over the country, the Asset Funders Network is doing some of that work around saying, you know, at the end of the day, we might all be asset and wealth building funders. And so that is a space where I think, especially in some of our geographies, we've seen a lot of different philanthropic partners come together, but then also invite financial institutions, public sector partners, community partners, CDFIs into the space as well. And I think, financial health has been somewhat of a rallying cry. And I think as we are pushed more and more, even in the philanthropic space, to have some rigor around the interventions and investments we make, having data and access to more data that gives us a better understanding also elevates our ability to be influencers in sectors that we don't sit in every day. So I think we have leveraged the idea that financial health really does intersect with all of these other spaces, as well as having strong data resources and a broad tent, a broad umbrella to bring partners to the table and keep them there.
Wonderful, wonderful to hear that. Now, of course, as challenging as it can be to establish initial buy-in from collaborators, that initial buy-in step is really only the first step, right? Then becomes the hard work of implementing the solutions, sustaining the coalitions that you've built, and driving towards impact at the local level. So in your experience, what challenges and opportunities have you encountered when designing and implementing solutions, sustaining your coalitions, and driving towards impact? And I'll flag that this is a big question. We could spend another half an hour on this question alone. But since I do want to make sure that we are leaving a few minutes for audience Q&A, I'm going to ask you to keep your responses to just a few minutes in response to this question. And Amaya, let's go ahead and start with you this time.
Sure, and I'll do my best to keep it brief. When we're thinking about scale, going back to 60621, going back to the dashboard again with Chicago, Lawn, Englewood, and West Englewood, right? We see the median net worth, we see all the data points. I also mentioned that these are communities that are also overlapping deserts of grocery, pharmacy, banking, broadband, so on and so forth. And going back to the community that I used to represent, which is 60613, almost 20x the wealth, median net worth. I never had a project come across my desk as a city council member who had sign off on these things that were unfinanced or unfinanceable, not once in 8 years. And I was able to advance over $500 million in economic development. The community in 60621 with $5,400 in median net worth. We are asking communities to participate in capitalism without access to capital, without systematic access to capital. And so I would just ask, and this is the challenge, is why are projects in the community that I used to represent financeable over and over and over again, but grants and philanthropy are the only options in Black and brown communities? And that's the challenge that I keep butting my head against the wall about this.
Profoundly stated. Erica?
And I will keep it short because I also don't have the answer. I could sit and list the challenges, which is not terribly helpful. What I do think is to the point about why is philanthropic capital the only funding that is available? I think we recognize our responsibility and accountability as sometimes the first dollars in, with the responsibility of ensuring that we're lifting up that there should be more dollars in, right? And something should not rely on or be sustained by philanthropy. And so I think, we have a lot of conversations around social and economic justice. And I think that's where, this conversation lends itself, that it's not necessarily about sustaining on philanthropy, that it's about a bigger scaled investment.
Absolutely. Tamara?
Okay, so I have a simple and it's a complicated answer. So the simple answer here is, for us, opportunity is city government. It's not the only player in this, but city governments have a mandate for scale. And that's where the innovation, I think, is my answer to innovation. Now, the complicated part of it, it's city government. And so there are so many different priorities. There's so many different actors involved in how a city government does their work. And so I want to be really, really practical here to say that I put a lot of stock in getting city government folks to buy in to doing this really hard work. And data, want to shout out again to the dashboard, is oftentimes the jolt that folks need, because they always want to understand data. They always say, the first thing is like, what does the data say? And then they don't have access to data to be able to say that. And to be able to point to certain things that you can show in a dashboard like this is, again, a way for, we work with folks that are really excited about financial stability, want to do the work, but they also have to make the case to do the work, to spend their time when there's just 1,000 different things competing in a city to be able to do that. And to be able to then really point to these opportunities to jolt people to understand why this is important, why a mayor should spend time, why he or she should allow his or her staff members to work on this, is that initial buy-in, because it'll motivate people and it'll have people want to fight the good fight. And for us, being able to use data to make that case is the first and I think a foundational part of anything that comes after, which is always a challenge, everything that comes after buy-in. And I completely understand that, but in terms of the way we see things, that initial buy-in is really important.
Absolutely. Well, on that optimistic note, I do want to thank the three of you for this wonderful discussion. I personally learned a lot. Let's now turn to questions from our audience. And at this point, I'd like to invite Signa Mary to turn her camera back on and to rejoin us to field any potential questions on the dashboard itself. So beginning with our first audience question, this is a question about solutions for smaller cities, defined as less than 100,000 residents, who may not have as much capacity to implement some of the solutions that we've all been discussing. Have you seen smaller municipalities do good work in this area? So Tamara, I know you were just up, but if you don't mind tackling this question first, and then we can let the others chime in.
Yeah, no, we've seen, we tend to work with cities that are 75,000 or more. So 75,000 population is relatively small, but sometimes we cheat and we also go down to like 60,000. These solutions, if it feels, these solutions can be really big and cities might get overwhelmed. But I have to say, things like financial counseling, access to banking, are all things a city can right size for their own populations. It really does come down to, do you have the capacity to be able to do that? But I would say smaller cities actually can be really nimble, more nimble than a big city. And so would encourage smaller cities to look into it we've seen it work. We have a financial counseling program in Gaithersburg, Maryland, which is a relatively small city. And they're doing well. And then you have, financial counseling in New York City, which is huge. But I find small cities to be pretty nimble to get things done.
Erica and Amaya, anything to add to that? And I'll toss in another follow-up question about not just small cities, but rural areas as well. Anything to add on either of those points?
Just really quickly, I covered, when I started, all of Louisiana, including northern Louisiana, which also meant a lot of smaller, more rural communities. Monroe, Louisiana has an excellent financial health collaboration happening, as does Shreveport, which is bigger, Shreveport, Bossier. But I think to the point about how you're able to catalyze investment and interest and collaboration in a space in a small city where folks are very much touched by the inequities or by the disparities, you also see a level of investment and momentum and urgency around actually identifying and then implementing solutions that sometimes end up more bureaucratic and lethargic in larger cities with more resources. So I have seen a number of smaller municipalities do some really amazing and catalytic things, even given the limited resources they have, because relationships do actually make a difference, make a huge difference.
Wonderful.
Just quickly, I mean, I just mentioned earlier, the city of Evanston, outside of the city of Chicago, about 87,000 people just advanced reparations, a reparations program. Again, to be a really nice template for other communities around the country. But also another quick example is Erie, Kansas. Some years back when their grocery store closed, the town banded together and bought the store and reopened it as a public option. And so there are ways to innovate at the local level, and it just doesn't have to happen in the biggest cities.
Absolutely. Thank you. Thank you for those examples. Signa Mary, a couple of questions for you on the dashboard itself. An audience member wants to know about updates on the various components of the dashboard and whether there will be opportunities to layer in other relevant data, such as access to cars, transportation, medically underserved areas, access to financial institutions, et cetera.
Yes, no, thank you. So our data visualization team built the dashboard so that we can update it over time. That is built in. I'll tell you, it really helps if you let us know how you're using the dashboard and how it's impacting and improving things, because then that helps us make the case to get the resources we need to continue with updates. So when you use that dashboard and it helps you help the communities you serve, like reach out and let us know, that helps. And then in terms of layering on other data sources, I think we are interested in adding more metrics and data sources over time. And but you don't have to wait for us. Like, we've made all the data available in a downloadable format. It's in Urban Institute's data catalog, where we put out much of our data. It's also, you can do it directly from the dashboard, and then you can layer in whatever data you're interested yourself to.
Wonderful. Well, since we almost are at time, I think I'll go ahead and wrap up the discussion now. Again, would really like to thank our panelists for taking the time out of your busy schedules to join us, for sharing such insightful remarks. I'd also like to thank our webinar attendees for your engagement, for the wonderful audience questions, for taking time out of your busy schedules as well to join us. And I'd encourage all of you to stay in touch with us as we collectively work to improve the financial health and well-being of our communities. So thank you again, and have a great day. Please do take a moment to fill out the survey that was just dropped into the event link as well. Thank you.